Hi, and welcome back to Dede Talks, the Art of Specialty Lenses. Today we're going to continue our conversation with Stephanie Wu on billing and coding.
Another thing I like to have staff do is letting the patients know if they do have some sort of deductible and what the remaining balance is. Again, this is usually all done before the patient even comes in for their appointment. The staff might call them like the day before, and then they'll give them an estimate of their bill for that visit before they even are taken back to pre-testing. And then some clinics even have a dedicated person to go over what are the goals of the visit for today, and then what are the estimated costs. Again, this just helps to prevent sticker shock. A big piece of advice that this is one of the most common things when doctors are asking me about specialty lenses is, how do I know what's covered? How do I know what's not covered? The biggest thing that you can do is have somebody call for a pre-authorization every single time before you see that patient. And these are the things that you have to have. You have to have all of their diagnoses. So remember from the first slide, you want to have as many as possible because insurance may cover one thing and not the other. You want to have your fitting codes for your contact lenses and the service codes. The next thing is you want all the V codes for the actual contact lens or device. You want your usual and customary fees. And then most importantly, when you're on the phone with them, ask the insurance companies, are these things covered? And if so, how much can I expect to be paid? And they do all have that information. And then another question is that billing to medical insurance, this is something that can be done with specialty lenses, but the reimbursement rates will vary significantly based on the patient's insurance benefits and based off of their deductibles, their co-pays, and the different maybe ICD-10 codes that are actually covered for that specific diagnosis. Something people kind of forget about is that durable medical equipment is a piece of Medicare and a lot of these other big insurance carriers that has to be billed separately, but you can get reimbursement from the durable medical equipment side of their insurance for the physical device, so the V code that you're actually using. And then lastly, the contract, this is so important. I did not do this when I first started practicing, and there were so many issues. And now we've developed an amazing contract that's very easy to understand. And it explains everything as far as what are the cost of the services that we're providing to you, and what does that include? What are the cost of the lenses? If there's some sort of global period, what is the end date? And we write that down and have patients initial next to it. What is the remake policy? You know, if you're having to remake the lenses multiple times, is that an extra cost to the patient, or is that covered? What is the shipping policy? Every time that a patient needs a new lens, you're going to get charged a shipping fee. Is that something that's covered, or is that something the patient's going to have to pay every time? Most importantly, what is the refund policy? If for some reason these lenses do not work, what's the refund policy? Are they going to get any money back? If so, what is that exact amount? And then if they are doing some sort of payment plan with your clinic, that's also something to include. So these are all the things that I have in my contract, and this has helped me tremendously. Now that we have all of this and patients understand it and they sign it before we even do any lens ordering, this has helped prevent a lot of issues with our patients. There are some examples of contracts, so if you don't want to just start from scratch, there's a couple on scleral lens practitioners or business of scleral lenses. These are social media groups, but in that files section where the arrows are pointing, there have been some gracious doctors that have uploaded samples of their own, and then you can take those and then create them to your specific practice. And then other resources, YouTube has lots of information from the Scleral Lens Society, Contact Lens Spectrum, and all these other amazing publications have lots of information on specialty lens billing and coding. So it's really actually quite easy to find information that's accessible and free and can be really helpful. That's all I have for you, Dede.
Thanks, Stephanie, for those great tips on billing and coding. I'd like to also thank ABB for their support for Dede Talks, the Art of Specialty Lenses. Stay tuned for our next episode.